we are here to address an important public health issue: Mpox. The image appearing on the screen as I speak is one that my colleague, Dr. Cheryl Utada, and I captured with an electron microscope last year, showing images of the Mpox virus. Mpox is not a virus we are unfamiliar with. Between 2022 and 2023, the United States experienced an Mpox outbreak. However, the key difference is that the virus that spread during that outbreak was clade 2 of Mpox. Clade 2 has a mortality rate of around 1%, with mild symptoms, and much lower transmissibility and spread rate. On the other hand, clade 1, while more contagious, can lead to severe complications, and in some regions, it can increase the mortality rate to as high as 10%. Unfortunately, during the 2022 to 2023 outbreak, the most affected state was our state, San Andreas. Recent developments indicate that this disease could once again see an increase in our country. CDC reports show that no clade 1 cases have been detected across the country. Therefore, being prepared in advance is crucial to prevent a dramatic rise in cases if this virus spreads to our state. I strongly believe that we need to take a firm stance against the spread of this new subtype and the serious health issues it may cause, particularly in San Andreas and the rest of the United States. Although the risk of widespread transmission of this new subtype in the United States can be reduced by factors such as immunity and vaccination, we must not become complacent. The immunity gained during the 2022 outbreak, combined with the advanced healthcare services and living standards in the United States, provides a strong foundation to limit the spread of the virus. However, these advantages should not lead us to underestimate this virus. I firmly believe that the high-quality healthcare services in the United States will be effective in treating potential cases. Yet, we must not downplay the seriousness of this virus and must take all necessary steps to prevent its spread with determination. Let us remember that the measures we take in this regard will not only protect our health today but also safeguard our future health security. Increasing population-level immunity through vaccination in our states can reduce both the number of infections and the long-term transmission chances of Mpox. Vaccination is a critical but underutilized tool in preventing the spread of Mpox. However, this prevention not only involves preventing the virus within our state and country but also speaks to eradicating it globally. Since 2022, this virus has shown a significant deviation from its spread pattern in Central and West Africa, where people are usually infected by wild rodents and primates, and outbreaks do not cross borders. This tells us that unless we improve living conditions in Africa, raise the overall health level, and eradicate such diseases, we will continue to face consequences that affect us all globally. This means we need to intensify our efforts to eradicate diseases in Africa through a multinational alliance involving governments, international organizations, charities, and private companies, promoting vaccination and increasing access to it. If we fail to do so, not only will global outbreaks continue, but this problem will also lead to a dramatic and uncontrolled increase in the world's population.